Welcome to this video in the Nurse Education on Video series. The subject we're looking at today is pharmacology, the study of drugs. Now clearly it's important for all nurses, anyone involved in healthcare at all, to understand the way drugs work, when drugs need to be given, how they should be given, and probably just as importantly, when drugs do not need to be given. Because for most sicknesses, no drugs are necessary. When people are ill, there's three basic important things to do for them. The first is to make sure they get plenty of rest. The second is to make sure they get plenty to drink. And the third is to make sure they get a nourishing diet so the body can recover. And most times when people are ill, the body will recover on its own without needing to give drugs at all. Now very often when people are ill, they ask for drugs. They see drugs as being the answer to all their problems. In a lot of parts of the world, people think injections are very important and ask for injections when they really don't need them. Now, as a healthcare professional, when someone needs drugs, it's our duty to get that person those drugs. But when they don't need drugs, it's our duty not to give those people drugs. We should never give unnecessary drugs. Instead, we should explain why they don't need drugs and give advice on how they can make themselves better and improve their general health or the health of their children or members of their family without the need for drugs when drugs are not appropriate. When medicines are not needed, take time to explain why. So when used correctly, medicines are life-saving. When they're not, they can be very dangerous things indeed. When someone's got a cold, there's no point giving them drugs because it's a virus and we have no effective viral drugs against the common cold. So just let them rest and give them lots of drinks. If someone's got a cough and they've got thick mucus, then sometimes antibiotics might be necessary. But if you give them lots to drink as well, that will help to dilute the mucus that the lungs are producing and they'll be able to cough it up. So it's a treatment that you can give without giving drugs. Sometimes as well, if someone breathes in hot water vapours, that can help to loosen up sputum and help them cough it up. Again, another treatment you can do without the necessity to give drugs. In diarrhoea, well, occasionally with diarrhoea it's necessary to give drugs, but most times it isn't. In most cases of diarrhoea, if you actually give antibiotics, for example, it can actually make the condition worse. So if the diarrhoea is severe, we need to give oral rehydration salts, as we've discussed on another video program. Give them plenty to drink, give them something to eat, but don't give them milk to drink, especially in children. Children with diarrhoea should not be given milk to drink. So it's rest, food and fluids again. Drugs very often not being necessary. But drugs are occasionally necessary, and we'll look at some criteria that need to be followed every time drugs are given after this. Now normally doctors will prescribe drugs, although sometimes people who aren't doctors do need to prescribe drugs. But when we're giving drugs that are prescribed, we must always give the right dose of the right drug to the right patient at the right time via the correct route. These are the 5 rights of drug administration, and if you're giving out drugs, you must get each one right every single time. So the right dose, that is the right amount of drug, must always be given. Of course the drug itself must be right. We must not give the wrong drug. We must have ways of checking the dose and checking it's the correct drug. And we must give it to the right patient. So we must have some way of identifying the patient. Very often we give the patients an identity bracelet and we check this before the drug is given to make sure we are giving the drug to the patient the treatment is prescribed for. It should be at the right time, because the timing of drug administration is important, and it should enter the body via the appropriate route. And we'll look at some routes that may be used to administer drugs later on in this video. Now, drugs are chemical substances which are introduced into the body to bring about some sort of physiological change. About a quarter of the drugs, about 25% of the drugs we use, are derived from some natural product, normally from plants. Others are chemically synthesized. But the point of giving a drug is to bring about a physiological change in the body. And drugs may be used to cure a patient, to improve a patient or to relieve symptoms, to help in diagnosis, and sometimes they're used prophylactically in order to prevent diseases from occurring. So drugs are chemicals introduced into the body to bring about some form of change, and many are derived or were originally derived from natural products. For example, these plants are foxgloves, and the leaves are poisonous. But if you take the leaves in very small amounts, the leaves have got digoxin in them, so herbalists have used them for a long time for heart conditions, although now we like to measure the doses rather more precisely. Other drugs from natural sources include atropine, quinine, aspirin, and opium, morphine, is also derived from natural plants. Other systems of medicine use other natural products. Here's me chatting to some chap, and I'm actually not too sure what he was selling. So drugs derived from natural products are very often useful, but these days, to get the precise dose, we give them in the form of medicines rather than giving the plant itself. It's much safer to do it that way. Other drugs are derived synthetically, that is, they're made chemically in the laboratory. For example, beta blockers were chemically synthesized drugs. Drugs are given to bring about a physiological change. So, for example, one of the drugs we mentioned there, atropine, will speed up the heart rate. It brings about a change in the body. And drugs may be used to cure the patient. Now, antibiotics can sometimes bring about a cure, which is very nice. But very often drugs will bring about an improvement as opposed to a cure. Or sometimes drugs can relieve symptoms. For example, analgesics can take away the pain, but often don't deal with the underlying condition. Some drugs are used in diagnosis. For example, X-ray contrast mediums, and sometimes other drugs are used to diagnose conditions. And prophylaxis, sometimes drugs are given to prevent disease from occurring. For example, if you're travelling to an area where there's a lot of malaria, it may be advisable to take malaria tablets as a prophylaxis to prevent malaria, to prevent yourself from catching malaria. What we're going to do now is run over a few terms that we use in our discussion of drugs. Now, the first term I want to introduce is that of a prescribed drug. So a prescribed drug is one which is recognised by the country where you practice. So in the United Kingdom, we have a book called MIMS and another one called the British National Formulary, and all the drugs that are allowed to be prescribed are listed in that book. And a drug is ideally prescribed by a medical practitioner, although other people do sometimes prescribe drugs. So a prescribed drug is an officially recognised legal drug. Now, this is in contrast to drugs of abuse or recreation. Now, I suppose whether you call it a drug of abuse or recreation depends on your viewpoint. The people that are taking them take them for fun. It's a recreational activity. Other people would see it as an abuse of taking drugs, that they're taking drugs when they don't need drugs when they're ill, but they're taking them for fun. Alcohol is a very common recreational drug. So is nicotine, so is cannabis, opium, amphetamines, barbiturates. The list goes on of various drugs that people take just for the fun of taking the drug, because it has some effect on their mind. Of course, nearly all of these drugs can be addictive, and in long term or even in the short term can be really quite dangerous things to do. So healthcare professionals always discourage recreational drug use. Next term I want to talk about is indication. What is the indication for a particular drug? Now, the indication means the reason the drug is given for. So, for example, morphine is indicated in pain, or pain is the indication for morphine. So, indication is the reason that the drug is given. The next term is contraindication. Now, contraindication means when a drug must not be given. So, for example, morphine must not be given when the patient is having difficulty breathing or there is respiratory depression. It is when the drug must not be given. So the contraindication, the drug must not be given if that is present. The next term is side effect. Now, all drugs have side effects. There's the indication, which is the reason you give the drug for. So, for example, if you've got a chest infection, you might give an antibiotic. An antibiotic is indicated in some types of chest infection. But a side effect might be that the patient gets diarrhea. So diarrhea is a side effect. It's an effect that the drug has that you don't want the drug to have, an unwanted effect of the drug. Another term in pharmacology is interaction. Some drugs interact with each other. Some can potentiate the effect of the drug, making it more. Some can inhibit the effect of another drug, making it less. Or sometimes foods and other things can interact with drugs. So interactions such as potentiations, which can enhance the effect of the drug. Another commonly used term is special precautions. Now, a special precaution is when the drug can be given, but you've got to be very careful about it. So, for example, in pregnancy, you should always be very careful about giving drugs in pregnancy and make sure that this drug is not going to cause any harm to the unborn baby. So pregnancy is always a special precaution. Other special precautions are patients who have renal failure because they can't excrete the drug, or someone with liver disease because they can't break the drug down. So a special precaution means, yes, the drug can be given, but you've got to be very careful about how you give it, when you give it, and monitor the patient carefully as you go along. The dose of a drug refers to the weight of the drug which is given, normally in milligrams. So the dose is the weight of drug given. The route is the way that you use to get the drug into the body, and we'll look at those shortly. A toxic effect is an effect that the drug has if you give too much of the drug. Now, toxic effects can occur the first time you give a drug, but very often it takes time for toxic effects to build up. For example, if you give a lot of sleeping tablets, the patient can be very sleepy and almost unrousable. It's an overdose type toxic effect. If you give too much digoxin, the heart rate can be reduced. If you give too much morphine, the respirations can be inhibited. There can be respiratory arrest even if you give too much morphine. So a toxic effect is an effect of the drug, but it's too great an effect of the drug, greater than the effect that you want. Another term in pharmacology is tolerance. Tolerance. Now, this occurs when a patient gets used to the drug. Alcohol is a very good example of this. When someone starts drinking, they might be drunk after drinking a pint of beer. But after 10 years of drinking, it takes 5 or 6 pints of beer before they get drunk, because the body becomes tolerant or resistant to the alcohol. It's often the case with analgesics. A particular dose of analgesic no longer has the analgesic effect that it used to have, no longer has the pain-killing effect that it used to have, and it's necessary to increase the dose to get the same therapeutic effect. And the last term I'm going to talk about in this list is compliance. Compliance is the degree to which the patient complies or obeys the instructions that you have given him or her about taking the drug. So if you give a patient a drug, they take it exactly when they're supposed to, then that is good compliance. Poor compliance is when the patient doesn't bother following your instructions, or maybe even doesn't bother for taking the drug at all. So it's very important to understand that the patient understands the instructions that you have given as regards taking the drug. Normally what I would do in this situation is explain how the drug has to be taken, then get the patient to explain it back to me so I know they understand it. Compliance is very important. For example, in antibiotics, if you take half of the course then stop, all you do is make things worse by increasing the amount of resistance to those antibiotics. This is one of the reasons that tuberculosis is such a big problem, because the drug needs to be taken for several months and people don't comply with the treatment, producing more tuberculosis resistance. Examples of potentiation might be alcohol and barbiturates. The alcohol enhances the effect of the barbiturates, or warfarin and aspirin taken together. There's an increase in the effectiveness of the warfarin, causing more bleeding, or erythromycin and carbamazepine can potentiate each other. So be aware of this possible risk when you're giving more than one drug. Now, everywhere now uses the metric system for measuring the doses of drugs. And it's important that we understand this. These sort of terms are used quite often. Deci equals a tenth, centi equals a hundredth, milli equals a thousandth, and micro equals a millionth. Let's look at these in practice. So 1 microgram we refer to as 1 mcg normally. That's the normal way to abbreviate that. And there are 1,000 micrograms in 1 milligram. So micro means a millionth, but that's a millionth of a gram. So, but the key thing to remember is that there's 1,000 micrograms in 1 milligram. 1 milligram is normally written like this, and there's 1,000 milligrams in 1 gram. So 1,000 micrograms equals 1 milligram, 1,000 milligrams equals 1 gram. And normally drugs are measured out in milligrams. That's the normal way to measure it. Now for volume, 1 milliliter is equal to 1 cubic centimetre. 1 cubic centimetre is if you have a box that's 1 centimetre by 1 centimetre by 1 centimetre, that would be 1 cubic centimetre, and that would be filled by 1 millilitre. But we normally use the term milliliter when we're talking about volumes. 100 mils is a centilitre, but we don't use that term very often. But it's important to know that 1,000 mils equals 1 litre. But normally drugs, if they're in solutions or syrups, are just measured in terms of mils. But one thing's very important if you are giving drugs in liquid form is you make sure if they're suspended that they're properly shaken up, so you get an equal concentration of the drug throughout the dose that you're giving. So let's think now about how concentrations are measured. Normally, concentration is measured in the number of milligrams per mil of drug. Or weight for a particular volume anyway, normally milligrams per mil. But technically the unit of concentration is a mole, although we don't use this very often. Now if you're interested, 1 mole is the number of atoms in 12 grams of carbon. In other words, it's a particular number of atoms. And a molar solution is that number of molecules in 1 litre of water. But if you don't understand that bit, don't worry about it too much because it's not used that often. But a mole is a number of molecules. And a millimole is 1,000th of a mole. In other words, 1,000 millimoles equals 1 mole. But the key things to remember are that there's 1,000 micrograms in a milligram, 1,000 milligrams in a gram. There's 1,000 millilitres in a litre, and concentrations are normally measured in number of milligrams per drug, number of milligrams of drug in a particular volume measured in mils. Let's have a little exercise now, look at some dosage problems. Things that you might need to work out in the clinical area. First one, how many milligrams of a drug would you give for a prescription of 600 micrograms of the drug? Well, remember, there's 1,000 micrograms in a milligram. We want to know how many milligrams we're going to give for a prescription of 600 micrograms. So that would be 0.6 of a milligram, because there's 1,000 micrograms in a milligram. A syrup contains 10 milligrams of a particular drug X per mil, just leave that off, per mil. So there's 10 milligrams of a drug per mil. How many mils would you give for a prescription of 35 milligrams? Well, 1 mil would equal 10 milligrams, 2 mils would equal 20, 3 mils would equal 30. We want to give 35 milligrams, so it's 3.5 mils would equal 35 milligrams of the drug. So if a drug contains 10 milligrams of drug X per mil, we will give 3.5 mils to give the 35 milligrams of the drug. Question 3. How many 250 milligram tablets would you give for a prescription of 1.5 grams? Well, remember there's 1,000 milligrams in a gram. So 4 250 milligram tablets would be 1 gram. 5 250 milligram tablets would be 1.25 grams. So 6 250 milligram tablets would give 1.5 grams. If you have tablets of 0.125 milligrams, how many tablets would you give for a dose of 0.25 milligrams? Well, 0.125 milligrams is half of 0.25 milligrams. Therefore, you would give 2 tablets. 2 tablets. Next one's a bit harder. If a drug is given in a dose of 50 milligrams per day, and it's given 4 times a day, how many milligrams would be given per dose? Now, it's very important sometimes to know how many milligrams of a drug are supposed to be given per kilogram of patient body weight, especially if you're dealing with children, because the drugs must be given in proportional amounts to people with smaller bodies. So the first thing to work out is the total amount of drug that needs to be given per day. So we give 50 milligrams of drug per kilogram of body weight, and we've got the information here that the patient weighs 60 kilograms. So we'll multiply 50 by 60. 50 multiplied by 60 would give us 3,000. So the patient needs a total of 3,000 milligrams of the drug per day. But we want to give it in 4 doses, so we must divide 3,000 by 4. And if we divide 3,000 by 4, we get 750 milligrams. So the patient needs 4 doses per day, each dose containing 750 milligrams. And just before we leave drug dosages, let's just note that some drugs aren't measured in milligrams, they're measured in agreed international units. For example, insulin now, certainly in the United Kingdom, is made up as 1 mil of insulin equals 100 international units of insulin. So half a mil of insulin would equal 50 international units. Let's now go on and look at the routes via which drugs may be given. Now, drugs may be given for a local effect or a systemic effect. A local effect or a systemic effect. So if you give a drug for a systemic effect, you want that to work around all the systems of the body. So the purpose of giving a drug via a systemic route is to get that drug into the plasma, to get that drug into the bloodstream so it will be carried or around the body to where it's going to have its effect. Some drugs, though, you only want to work locally. So, for example, if you put on a topical cream, you just want that to work locally. If you give a local anaesthetic, you want that to work locally. Or even if you're giving inhalers, bronchodilators, then you want that to work locally in the bronchial tree. But of course, if you give a drug into the bronchial tree, you will get some systemic absorption into the plasma as well. So drugs may be given for systemic effects or local effects. Now, when we're giving drugs systemically, we normally divide this into two broad categories of giving the drug. Firstly, drugs may be given via the enteral route, and secondly, drugs may be given via the parenteral route. Now, enteral means via the gastrointestinal tract. So if you take tablets or medicines orally, that's enteral administration. You could be giving suppositories or drugs per rectum. Because it's via the gastrointestinal tract, that's also described as being an enteral route of drug administration. A parenteral route of drug administration normally applies to giving a drug via an injection, although it can mean other things, but normally it means injection. So drugs may be given for a local or systemic effect. The purpose of giving a drug for a systemic effect is so that that drug enters the plasma and goes round everywhere the circulatory system goes. Drugs which we want to act locally include local anaesthetics and topical ointments. Drugs may be given via the enteral route. So enteral means to do with the gastrointestinal tract. And drugs may be given via a parenteral route, not via the gastrointestinal tract, normally by injection. So when drugs are given orally, they normally start to act after about 20 minutes. It depends on the type of drug. Some will work quicker, but normally you get reasonable systemic absorption after about 20 minutes. So if you've got a headache, you take some paracetamol tablets, they'll normally start working after about 20 minutes. It's also possible to give drugs enterally via a nasogastric tube or a PEG tube going straight into the stomach. And again, it would take about 20 minutes for the drug to start acting, because it's going via the wall of the stomach. Rectally, well, it depends how much feces is in the rectum at the time, but maybe about 15 minutes for a drug to start acting systemically after it's introduced into the rectum, as long as there's contact between the drug and the wall of the mucosa. Now, sometimes drugs are given sublingually under the tongue. Sometimes glycerine trinitrate for angina, for example, is given under the tongue. And this can start to work very quickly, just a few seconds sometimes. It can be longer, again, depending on the type of the drug that's being, the type of drug given. But under the tongue often works quite quickly. Now, if you give a drug intravenously, that's going to work very quickly indeed, normally about sort of 10 to 15 seconds. Because the drug's being introduced straight into the plasma, it starts working straight away. So intravenous bolus injections work very quickly indeed. Same with intravenous infusions, they can start working within a few seconds of being administered. Now, intramuscular injections, where the drug is introduced into the muscle, they take a little longer to start working, normally maybe 5 to about 10 minutes, something like that. Again, it varies depending on the condition of the patient and the type of drug. Things given subcutaneously, just underneath the skin, into the adipose tissue below the skin, again, they can start working in about 10 minutes. Occasionally we give drugs actually into the skin itself, into the dermis, and they take quite a lot longer to start working. The only thing actually I've heard of given via this route is vaccines, and they would take several days to start having an effect. So what we're interested in this graph is the passage of time along here and the relative plasma concentration of the drug on this axis here. Now, when drugs are given intravenously, the levels obviously of the drug in the plasma rise very quickly and reach high levels. But they often tail off fairly quickly as well. So although high plasma concentrations are reached,